We are diving into women's health issues in this next Care to Know segment, and there's one topic that often gets whispered about but deserves to be discussed openly. Genitourinary Syndrome of Menopause, or GSM for short. And no, we're not talking about a new smartphone model. GSM can significantly impact a woman's quality of life, affecting her sexual health and overall well-being. Today, I'm joined by Dr. Christine Palmay, a family doctor from Midtown Toronto, who is here on behalf of Care to Know to help us understand this common condition and the available treatments. Welcome back, Christine.
Thanks for having me, Candace.
Well, this is certainly a whispered about condition because I had never heard of it. So how does it affect postmenopausal women?
Well, you aren't alone, Candace. I mean, really, there has been in the past 20 years a real dark period for women's health in terms of menopause, postmenopausal, and perimenopausal treatments. You know, women aren't talking about it, physicians aren't bringing it up, leaving many women with symptoms that can be solved or at least treated and minimized suffering in silence. And don't whisper, shout out. We're here to open up the dialogue. And I really want to be emphatic that these are common symptoms, right? Most women postmenopausally, and certainly women perimenopausally, have we call the genitourinary syndrome. I call it symptoms. And it's not just a dry vagina that's typically appreciated. It's feeling that you're constantly having urinary tract infection, irritation, a little bit of incontinence. It's really the entire system that gets affected and can drastically affect a woman's quality of life. Sex becomes painful, unpleasant. It shouldn't be. Women feel that they can't leave without wearing a pad or a diaper because they're worried about being incontinent. And that irritation is quite frankly irritating. But we have options, many of which are changing. This is the renaissance of women's health that's running along the renaissance of immunizations as well. So you need to open up the dialogue, talk about your symptoms, and make sure you ask what's available.
And I know that you're a big proponent of knowledge is power, and so we're here to inform people. So when women go to see their primary care physician and they want to discuss GSM, how do they open up that conversation with their doctor?
I think simply saying, I would like to talk about I often have people phrase it as my change in hormones, how I'm approaching menopause, what I can do. I have these symptoms. Insist on a pelvic exam. You don't get one from your primary care provider, go elsewhere and get one. It's really important for a primary care provider to examine the patient and see, what's actually happening to rule out other things. And, the treatments we have are vast. There's lifestyle changes, so losing lubricants during sex, proper vaginal hygiene. But in terms of medications, we've come a long way with hormone replacement therapy. A lot of GSM can be solved by topical treatments which come with less risks. And we have pills and lotions and tablets, ovules, and what's lovely about the choices that we have is that they can be catered according to that woman's specific symptoms or preferences. Some people like creams, personally don't. The cream comes out one side and the other when you're trying to put it on. Ovules are moisturizing. Some people, aren't comfortable, inserting an ovule. So we have applicators that can be used. And in some cases, we also have an oral pill, right? So the options are there. We just need to provide education, and the medical community has to do better. I am certainly part of that movement, trying to encourage primary care physicians and other allied healthcare professionals to open up the dialogue. But as women, show up, say, this is concerning, I want to, and I need to talk about it.
And, it's really important, obviously, to advocate for your health because there's really long-term consequences from ignoring these symptoms, right?
Absolutely. I mean, incontinence can become worse. And unfortunately, unless you rehabilitate the tissue early, the longer you wait, the harder it is to rehabilitate. So early treatment is absolutely important, absolutely essential. And, we all want longevity, but we want longevity with quality of life. And that's a key point I often mention to patients as well.
Absolutely. And it's so important that we do open up this conversation and normalize it because there are a lot of women walking around who have no idea what's going on and feel like they're losing their mind with the symptoms.
or have normalized their symptoms, and that,
Right.
oh, my mother has it, my sister has it, it's just part of aging. It may be a consequence of aging, but it's not inevitably um, without treatment, right? So you don't have to suffer. You just have to start the dialogue. And the first thing is become informed, understand your condition, somewhat understand what conditions are available, educate yourself beforehand so you can have a discussion with the healthcare provider suggesting treatments.
All right. So if people want to find out more, they can go to caretoknow.ca.
Yeah, we've talked about this regularly. I am a huge supporter. caretoknow.ca, free, sign up. You get medical information delivered to your inbox. There's some interactions that you can have. Information is updated medically, updated also according to new innovations. The topic range is also expanding. Really quite excited about this initiative, particularly when so much misinformation is out there. And when it comes to your health, you want to make sure that the information that you are gathering is credible.
We're not whispering about this anymore. We're shouting it out. And you have a blog post on whatshesaidtalk.com that goes into this subject deeper for those who want to learn more. And thank you for joining me. You'll be back next month.
See you soon.